Just to do the last few couple slides, can't stress enough how important it really is to manage pancreatitis patients really with a lot of precision, because you did see in that earlier slide that they can, gradually move into shock and have more serious complications, which would necessitate them being moved to an intensive care unit. So we won't go into all the types of things that would take place at that point, since we're not doing critical care, but think about this type of patient that you're really managing and monitoring them. Besides just all these things listed, what are their vital signs, and are there any, when we think about continuous monitoring or fairly frequent monitoring, what are those lab levels, and are we seeing when the, calcium and magnesium come back? Is the doctor remembering to order those every single day? And then, how well do they tolerate all this? Are they more agitated with pain? The emotional impact to someone who has an alcohol addiction, complicates this tenfold, as you can imagine, because they're hurting and they're miserable, and they can be really having cell destruction and complications that lead to death. At the same time, that if they're addicted to alcohol, they may still be wanting some. They might be sneaking some in to the hospital, and some of those kinds of issues as well. So not everybody develops pancreatitis because of that, so you don't want to lay that bias on every patient, but you definitely want to be thinking about that and having a very open method of communication with patients, so that you can educate them and they'll listen to you better than they typically might just obtaining a lecture on their drinking habits, for example. And so often you'll find that some of these folks that have this issue, if they are alcohol consumption related, they may not be sharing all that with family and friends. So when they get sick with this, and people kind of equate those two things together, they may be getting wrongly accused of something they don't have a problem with, or maybe it's the first time their family really has realized how serious this issue might be for them. So, try to be very cognizant of collaborative care with the team, really focused on vital signs monitoring and management, laboratory management, maintaining good IV sites. And if they should develop severe abdominal rigidity symptoms, like we've talked about before with peritonitis, that is something that potentially is going to require them to go to surgery, perhaps, or maybe some other interventions. So you definitely want to notify physicians readily if any of those changes occur. It's just a picture that kind of shows some of the autodigestion and kind of the way the pancreas is looking in this CT scan. And again, these are the complications that you're going to be monitoring for. Hypovolemia. So how would you know that? You would be looking at, what does their CBC look like? Do they look like they're, dehydrated? Can you tell that from their laboratory work daily? You might be looking for hemorrhage. What was their hemoglobin one day? What is it the next? Trending that for any changes. Or actively watching and looking at what does their bowel movements look like? Are they having any bleeding, any other symptoms in terms of hemorrhage or shock? What kind of perfusion and blood pressure do you see that goes along with hypovolemia, hemorrhage, or shock? You may see acute kidney failure just because of this being so severe as well. So monitoring BUN and creatinine is important. Um, if they get to the level of shock, obviously they need moved out of the typical traditional med-surg unit. They also can develop pleural effusions, respiratory distress syndrome, pneumonias, down to multi-system organ failure, DIC, and even diabetes symptoms as well. So, that's a huge long list of complications to be monitoring an acute pancreatitis patient for. So just realize that their care, people tend to think, well, this is a pancreatitis patient. They got themselves into this situation. And kind of that bias sometimes does not lend itself to the kind of caring and extreme monitoring stance that you should have to prevent or at least watch out and treat as fast as possible any of these type of complications. So just think about it. If you have somebody that has hypovolemia, what do you think they're going to need? They're going to need a large bore IV. They're going to need fluids given. If they've developed hemorrhage and it's a brand new hemorrhage symptom, you're going to notify the doctor, or you're going to call rapid response if they're unstable with their blood pressure at the same time. Most all these issues right here, you're going to be getting in contact with somebody very rapidly. Patients can also develop chronic pancreatitis, and this is just a progressive destructive disease of the pancreas and it is kind of like you'll have flare-ups of it or exacerbations of it, and then it'll kind of get a little bit better, but it never really gets totally normal. It just kind of stays chronically in a not good shape. But it gets worse at times, and then it kind of eases off at times is a good way to think of it. And most chronic pancreatitis patients are treated non-surgically with drug therapy, pain management, and enzyme replacement. You may have seen patients that were getting pancreatic enzyme meds that we give to patients sometimes in the hospital by mouth. The only frustrating thing I see about that sometimes is they have to take so many pills. In a dosage, it can get to be a lot for somebody to swallow that's not having the greatest appetite or intake. Sometimes they may end up on insulin therapy because of the diabetic symptoms. And again, they may need alternate methods for nutrition therapy because they're not going to absorb well. So you may see them have to be on different kinds of nutrition, whether that be TPN or something, so that the GI system rests. And you notice after both of these, there's several little questions. Use those as your challenge questions. If you can see, I think, when you open up these, the answers. But if you have any questions about any of those, please feel free to send me an email, and I will try to post us some different questions related to these besides these later this week on the page so that you can practice if you would like.